I'm also the chairman of the Malaysian Influenza Working Group. So it's an interest group under the Malaysian Society of Infectious Diseases and Chemotherapy. So going to bring you through how we in Malaysia um, doing some advocacy work and related to how we lobby the government to fund influenza vaccines for our elderly. So it's work in progress. These are my disclosure. So just to begin with this particular slide, highlighting the fact that right in the middle there, Malaysia is actually having a problem of very low uptake of vaccination, influenza vaccination, together with the Philippines, Indonesia, and also Vietnam, as compared to Singapore and Thailand. And of course, we are nowhere near other developed regions in South Korea, Taiwan, and also the UK. But on the right is a more updated figure post-pandemic. So a bit of improvement, but just to tell you is for Malaysia is a bit of dismal. This is a small study indicating just 5.5%. So a bit about Malaysia. Malaysia is located north of Singapore, as everyone know, and we are about 33 million people. And the life expectancy is about 74.8 years at birth. And also we are an aging society. The current percentage is 7.2% of our population 65 years and above. So by 2040 is predicted to be 14.5. So by this definition, we are going to be an aged nation by then. But we are not alone in this region. If you look at here, Singapore, top of the list, followed by Thailand, Vietnam, and we are number 4. And followed by Indonesia, Myanmar, Philippines, and Cambodia, and Laos. So very soon, everyone become an aged nation in this particular part of the world. And moving to influenza surveillance system in Malaysia, we do not have a very advanced surveillance system if compared to China, the UK, or US, and even Australia. But our system is fit for purpose, which is to design to detect outbreaks rather than to measure the public health burden and also economic impact of influenza. So this needs to be changed. We need more reliable data from this. We need to really enhance our national influenza surveillance system in order to effectively prevent influenza and to influence also policy change. The main challenge is actually to prioritize. We have so many competing health priorities. So that is really a challenge for our group to push this agenda forward. This is the situation taken from the Global Influenza Surveillance and Response System in the FluNet. As you can see over the left, you see that Malaysia has reported very few cases of influenza. And of course, during the pandemic, which is in the middle, virtually there were no cases. And guess what? After the pandemic, you see a tremendous increase of cases being reported. And particularly in the middle of 2023, you see a lot of influenza Bs as indicated in the brown color there. So this is just before the pandemic, which is around December 2019 and early 2020, before the pandemic was announced somewhere in March. We recorded huge number of influenza cases, particularly among students and in schools and secondary schools, up to the point that people were rushing for vaccines and there were no stock for vaccines and even rushing for Tamiflus. So then came the pandemic. So we don't have any cases during this time, during the series of lockdown, fortunately. And after the pandemic, as you can see here, that there were so many cases. And this is recently in the news, and we are also seeing now lots of influenza cases. There were insufficient hospital beds, and these clusters were mainly reported in primary and secondary schools, and also we have, coincidentally, we had a by-election at that time, and one of the politicians, prominent politicians, came down with influenza and has to take a rest for 3 days and missed that campaign. So that shows that influenza is again in the limelight. It is a problem, a serious problem in Malaysia, even though people tend to ignore it, that those age 65 and above at risk of having hospitalization or death. And we all know that vaccination remains one of the most cost-effective interventions to protect any infectious diseases. In a study mentioned that in a low and middle income country, immunization programs were found to be able to return about $51 if you spend about $1. And in countries with aging population, vaccinating older adults was found to be the most cost-effective strategy. And those in the US, a cost saving of about $15,000 per quality adjusted life years gain. So it's really cost effective. And this is in influenza vaccination rates in selected countries. As on the right, you can see that it is the UK, Korea, Denmark, Ireland, and United States. Whereas in the left is Turkey, Latvia, Bulgaria, Poland. So it indicates that very diverse in terms of vaccination uptakes with these various countries in OECD. Well, in Malaysia, the vaccination rate is very low, and this is particularly due to the fact that we don't have a formal adult immunization program. And while asking around, getting data from sales and so on, we estimated it's about less than 2% of the population were vaccinated in influenza. Even though Ministry of Health actually recommends adult vaccination or adults vaccines, but the in terms of the expenses is financed out of pocket. So that is a big problem. We don't have a reimbursed what do you call that, funds for what was implemented in other countries, and it was given mainly in private sector. So this is the study highlighted just now that 5.5% of the elderly were vaccinated for influenza. Right. Malay elderly was more likely to be vaccinated against influenza, particularly because they were required to receive influenza vaccination before Hajj or Umrah pilgrim to Mecca. So even though it was highly recommended, even the uptake of the influenza vaccines was very low. It's about 28.6%. So again, I would like to show you this particular slide again to highlight the fact that we are having very low uptake. And why is this so? We look at the reimbursement, government reimbursement for the adults vaccines. Malaysia has none, as well as Indonesia and Vietnam. But for Singapore, Thailand, and the Philippines, they have full reimbursement. That's what explains why Philippines just now, from here, it is quite low, but the recent data, there was increase in uptake. Bear in mind that Malaysia budget now provides tax exemption. So it's a good start, about 1,000 ringgit per person, it's about 300 Singapore dollars to cover for vaccination expenses for adults vaccines, like for example, pneumococcal influenza and COVID-19 vaccines. So this is a good start when we lobby to the government. Right, so there's so many barriers to life course immunization rates in ASEAN. When we talk about life course immunization, was mentioned by Professor Raja just now. So that includes influenza as well. So among the barriers highlighted in this document was life course immunization was not recognized as an important pillar of the National Healthy Aging Policy. And also there's an overall lack of public immunization policy framework and implementation to promote and fund the immunization costs. In terms of financing barrier, there is very high out-of-pocket expenses. And in terms of the delivery barrier, there's even low awareness and increased vaccine hesitancy among public as well as healthcare professionals. So we also lack of data to quantify the impact and to inform policy development. Realizing this, we have to do something as a group that we know that Malaysia is a rapidly aging nation and our elderly have multiple medical problems, and majority of our elderly are unprotected, and influenza vaccination, we know that is a core preventive health strategy to foster healthy aging. This is where I come from, the Malaysian Influenza Working Group. This is an interest group under the Malaysian Society of Infectious Diseases and Chemotherapy, was established in 2017. And we aim to work with Ministry of Health and all relevant stakeholders in enhancing prevention, management, and control of influenza in Malaysia. So our key interest is basically in surveillance, research, guidelines, and trainings for healthcare professionals, and advocacy and intercessions of vulnerable groups. So this is the main committee, a very diverse groups consisting of virologists, pediatrician, we have infectious disease physician, chest physician, and also public health specialist. So we also established the older person subcommittee under this main group, which is chaired by Professor Tan Maupin, who is the next speaker. And it's in collaboration with another society, which is the Malaysian Society of Geriatric Medicine, to address the needs of the older persons. So we come up with a position paper on flu vaccination in the elderly, highlighting the fact that those with 65 years and above have poor outcomes due to their comorbidities and also high risk of influenza-related hospitalization and death. And also, we recommend that the influenza vaccination should be given to all those 50 years and above, in taking into account the high rate of comorbidities among those in this particular age group, and to be taken yearly. And this is supported by 32 medical bodies and also NGOs. We did a lot of public education, and we appear in social media, we appear in newspapers, mainstream newspapers, TVs, radios, and so on. So these some of the research done by our group is available online. You can have a read. And also a research, this pending publication on cross-sectional study of influenza trends and costs in Malaysia, that we have found about 65 million US dollars during this particular year, and this is to be used for us later on to further highlighting the fact that this influenza is a burden in Malaysia. We have also come up with a guideline for prevention of influenza in older persons. Was launched in June 2023, and some of the key highlights of this particular guideline is that all persons aged 60 years and above who do not have contraindications should receive an influenza vaccine, and those with comorbidities should be prioritized for this annual vaccine, and they should receive any available influenza vaccine. And we also highlighted post-exposure prophylaxis with antiviral agents, not about a vaccine, but also and the use of antiviral agents as a post-exposure prophylaxis. And also highlighting about in the aged care facilities where we have our older persons there, that they need to be vaccinated, and what happened in the outbreak, they should be isolated and tested for influenza, and outbreak control measures should be instituted. Right, so we supported MOH in realizing government-funded influenza vaccination for older persons. It's not an easy job because it involves lots of money. Government needs to pump in money to actually finance this. So that is related to, now we are leveraging on the Ministry of Health has come up with the health white paper for Malaysia, where it's a new shift of focus. It is from curative to preventive. I heard yesterday was Singapore also actually has focused on the prevention. So I think that's going to emulate what Singapore is doing. and highlight the fact that we should not be focusing on curative. That's where we formed this alliance, a Malaysian Alliance for Prevention of Influenza, consisting of more than 30 professional societies and also NGOs, and with the aim of enabling access to influenza vaccination for high-risk groups. We started the petition campaign already. It's available online to get the noise from the public, and we get the aim is to get as many signatures as possible. To date, it's about 20,000 signatures from the public, and we aggressively appear in radio, TV. I was in a TV show for 1 hour highlighting the fact of this particular campaign, and also in a newspaper. So it's a bit aggressive on our side to push for this. And this is work in progress. So next is to see we have a series of engagement with MOH. Now is to get a lot of data to be shared with them, and also the press, and to go to parliamentary select committees to lobby for this. Well, we will write an open letter to the health minister and also media publicity campaign. MOH, we are going to support MOH in other areas like advocacy, healthcare professional training, public education, and also outbreak response. This is the latest news. Now, Ministry of Health is beginning to say something like this, giving seniors free annual flu shots and to provide vaccination to the public. Even though there's no funding yet, but this is something that they've said. So this is good news for us that probably they've kind of like changed their mind and support this particular initiative. So we are anticipating that sooner or later they will be approved. So the next challenge will be the implementation. How going to get the vaccine to the arm of the elderly? So that is another great challenge. First, we need to build up the healthcare professional influence to influence our doctors to recommend the vaccine to the seniors, which is not easy, and we are not trained to do that. Also building vaccine confidence to be bundled up with a life course immunization, not only promoting influenza alone, but it has to come along with some other vaccines as well that was recommended to the seniors, and also to counter misinformation. To have a sustainable program, we need data collection at the baseline and also on the coverage rate and also the impact of the program. And therefore, central immunization register is very important. So we have yet to, discuss about this. Is very new, but I feel that this is very important to move ahead to have an immunization register. And of course, easy access to vaccination points, as demonstrated with the COVID-19 delivery. And later on, we have to talk to insurance companies to include vaccination costs as part of the initiatives to reduce premium for them. Well, because prevention is better than cure. So this is my last slide. So thank you very much for your kind attention.
Thank you. I've got a question online that reflects your optimism, saying, right, you've solved the money problem. What is your next? You've just listed that. Which of those is going to be your biggest challenge? Convincing doctors, or making sure there's accessible sites, or confidence in the vaccine? So great list of questions. Which is the next biggest challenge or barrier?
Thank you very much for the question. The biggest challenge I foresee is to get the confidence from the seniors to get the vaccines. You know, if everything is given for free, people will take it for granted. And of course, we need to highlight to them the importance of getting the vaccine and so on. And of course, there will be misinformation and disinformation, things like that will happen as what happened in COVID-19.
And is that under the notion of vaccine fatigue, or is that why you think the older community will lose its confidence, or I'll just take it for granted?
More of vaccine fatigue.
fatigue. Yeah, we had a question over here, I think. Oh, we certainly got one up there. Sorry, yeah, I'm not sure he's got the microphone. Thank you.
Hi, Prof. Zamberi. Thank you very much for the interesting talk. My name is Daryl. I'm a student from NUS. I just have two questions about your talk. Actually, the first one is regarding, I was just curious how the influenza were detected in your national surveillance program. Is it only for patients with severe illness that were hospitalized? Because it's quite unlikely that, people who turn up to clinics with the common cold will be diagnosed with influenza infection. And then the second one is the interesting data you shared about how there was a 2020 outbreak of influenza just before COVID hit. And then there was a rush for the influenza vaccine. I was just wondering whether there was any strain identification, because we all know that with the current influenza vaccines, they're very much limited by the strain matching. And if there is a mismatch of strain, that could very much impede the efficacy of the vaccine. Thank you.
Thank you for the question. So the first one was, sorry.
How did you identify?
All right, okay. Cases in Malaysia was identified basically through hospitalized cases, and also in hospitals as well as in clinics. We have sentinel clinics. So basically, it's not. It's just a representative of the cases identified that we send and report to FluNet. So that actually complies with the basic requirement of WHO. If you look at the basic surveillance system, and it's not designed to, like I said, to detect, to have looking at the burden of disease of influenza in the country. It's just to detect outbreaks. The outbreaks just before the pandemic is particularly due to the fact that we have a very low vaccination rate rather than vaccine mismatch. And this happens, well, I can say once in a while that it happens in schools and so on. So outbreaks are barely detected when we have lots of residential schools, and that's where the outbreak starts. That's very typical of Malaysian data, and also from there it affects our seniors.
We've got another question from the floor here. You got the microphone.
Hi, Professor Sekawi. I'm Duncan Derek Thompson from AstraZeneca. I'm curious as to the low vaccination rate and what the difference between the different age brackets are, particularly looking at children. We've seen in other countries that having a high vaccination rate in children provides a protective element for the elderly population as well. So you mentioned a lot about the low vaccination rates in general. Could you comment on how it differs in different age populations?
We don't have data for that, but based on my observation, it's more in the older age group and less uptake in the children. I'm not sure. Maybe my colleague from Malaysia, Dr. Zul, is a pediatrician, can also comment on the uptake of children.
We had a similar question online about should it be included? Yeah, should it be more emphasis on everyone to stop the spread?
Definitely is one of the recommendations by WHO. But as a group, we are working on elderly first, because that's easily to tackle. It's a low-hanging fruit kind of thing. So we will tackle that as soon as we got approval for the funding for that. Then we'll move on to the other risk groups.
Just aim for free for everyone. I think that's a comment from.
Yeah, thank you. To answer your question, flu vaccine is not in the pediatricians' main focus at the moment. So that's the reason why the uptake in pediatrics is not as high as in Western countries. I have a question for you, actually. This is about competing priorities. The country is now, you've got a fixed number of funding, and then you want to ask for vaccination for the elderly, and then you've got TDAP for pregnant women, and you've got to sort of focus on the fixed sum. Most countries now are reeling from wasted COVID vaccines, which actually we've overbought, and then now we're throwing them away. So which should be the focus if you're looking at it from an administrator's point of view, not from your point of view as MSI, the Society for Influenza?
Yeah, if looking from a policymaker point of view, we need data. So what is the most impactful program, vaccination program? So data which will look, will guide us on which one to choose. Unfortunately, data is very scant in Malaysia with regard to epidemiology. Probably it's there in the Ministry of Health, but then for us, it's not available in the open publication. So again, data is very important to guide.
Thank you very much.